Can everyone organise a queue on this side?
So the facilities we have here come under the sort of remit of primary care, really. It's equivalent to a UK GP surgery. So it's a sort of simple triage process. We get unfiltered patients coming through the front door with all sorts of problems, minor skin problems, a lot of joint problems, arthritic sort of pains. We've seen a lot of asthma, and those things we are generally able to do something about. For example, a chest infection, which we can give some antibiotics for and hopefully cure.
There was a gentleman in his 40s who had a lesion on the left side of his face. This had been there for about 4 years, slowly getting bigger. The diagnosis was a squamous cell carcinoma of the face, of the skin, and it was quite a large tumour in the end, with some characteristics of invasion and infection as well. He had not had it treated, so something like that you would never see in the UK.
He came in with a rather unpleasant looking homemade dressing, which we took off and found this probably infected. It was an infection on top of the skin cancer that he's got, which we managed to wash out with antiseptic, dress it nicely. We gave him some antibiotics. So you're right, it's not going to cure his problem, but it's going to stop further problems arising from it, like infection and pain. And as I say, make the next few days until he gets on to his next treatment stage more manageable for him, really.
It started 4 years ago, and it's 4 months since it became infected. I'm in a lot of pain, especially at night, but since I was given medicine, I'm no longer in any pain. Since I came here, you gave me good attention, and the pain has eased.
Can somebody get the senior doctor for me, please?
A few moments ago, a young mother came into the facility with a 2-day-old baby that was also very unwell. She presented to one of the combat medical technicians here, who called me over and asked for my opinion about the child.
When I first saw the baby, I could see that, clinically speaking, she wasn't doing very well. Listening to her heart rate, it was very low unless I stimulated the baby in order to get a response. It was clear that she had a large mass to the back of her head, which may have been causing a problem with her systemically, perhaps stealing the blood supply that the baby desperately needed. The baby wasn't feeding properly from her mother, you could see that. And unfortunately, because the baby had already gone 2 days, it was far too difficult for any kind of care that we could have given. Without hospitalisation, the baby was going to die.
It was making a poor effort of breathing. The mother described a very poor history of breastfeeding over the last couple of days, so it's highly likely that the child is dehydrated, not getting the nourishment it requires, obviously having some breathing problems. The significant abnormality we could see was a large swelling on the back of the neck that the child was born with. That may indicate there are other more serious problems going on with the baby as well. I mean, the overall picture was just of a very unwell child that needed specialist help, and we've had a couple of cases like this with sort of acutely unwell people that we're actually unable to do very much for, which is very frustrating for us as doctors and medics.
This is invaluable training for our CMTs, nurses and doctors, because they don't get this exposure to these types of patients back in the UK. We generally see a young, fit, healthy population. They can find it very challenging because we are used to being able to cure people and get them back to work, and so it's good for us to be able to appreciate the difficulties that there are in medicine that we don't see day to day, and I think that would prepare us for future operations. We don't know where we're going to be in 12 months, 5 years' time.
My experience of the Army is that every exercise I go on to is always difficult, it's always new, it always challenges me in a different way. This has asked me to learn about areas of medicine which I might not normally concentrate on. There's a lot of tropical medicine, there's a lot of general practice that we wouldn't normally focus on. So from that point, yes, it makes me a better doctor. It makes me a better officer as well, because I have to involve leadership, and there's soldiering skills as well, and it improves my interpersonal skills, which whenever I have to go back into civilian street or back into an NHS hospital, it will always be a better for the patient.